You don't need a science background to study with us.
We stay confused often in anatomy, so we'll be right there with you.
Since we're starting anatomy, we're just going to keep everything very simple and visual. Think of the body like it's standing straight, facing forward. Raj, would you demonstrate it for us, please?
Yeah, I would love to. I'm gonna go right here, but when we say the anatomical position, we're referring to the body like this. Palms facing out, facing forward.
All right, so that's our default reference throughout all our videos. All right, so when we say anterior, we mean the front. When we say posterior, that means...
The back.
When we say proximal, that means...
Something that is closer.
And distal?
Farther away.
Just the opposite of proximal.
Exactly.
When we say lateral, we just means towards the side.
Yeah, this is lateral, and as you come closer to the middle, this is referred to as medial.
Perfect. So with that out of the way, let's look at the bones of the upper limb.
Wait, before we get into the bones, I think we should talk about the planes. And I have just the two to talk about them. All right, so now that I have the planes in front of me, I'll talk about them. So firstly, we have the coronal plane, and it basically divides your body right down the middle, like you're standing like this, and bam, right down the middle. This is the front half, and this is the back half. Posterior, anterior. No. Hold on.
No, you're right.
Huh.
Coronal plane divides the body into front and back, anterior and posterior.
Yeah, anterior front, posterior back. And then you have the sagittal or the median plane. So this is cutting your body into left and right. So bam.
And the last one?
And the last one.
Transverse?
Yeah, this one's a transverse or the horizontal plane. You're basically getting your body cut slightly above your nipples. So towards like the upper.
No, you cannot say that. No, you cannot say that. You cannot use the term nipple. Anyways, okay. So transverse plane or it's the only horizontal plane, and it kind of cuts your body a little bit below your neck, and more so you can think of it like looking from your head towards your feet, looking down. So real quick, the coronal plane is the imaginary plane that divides your body into anterior and posterior. You have the transverse or the sagittal plane that divides the body into left and right. And then you have the only horizontal plane or the transverse plane that kind of divides your body horizontally so that you can have the visual of looking from your head towards your feet.
Or your feet to your head.
Or your feet to your head.
Right. So yeah, these are the three imaginary planes of the human body.
Yep. And the three anatomical planes. So
Yeah.
it's important to keep that in mind before we get started with any sort of anatomy.
All right. Now that we got the planes out of the way, we can go and get started with the bones of the upper limbs.
A moment for this coffee being so damn fucking good.
Cheers to that.
Really good. All right. So the humerus is the one single bone that you can see on your upper arm. Well, not necessarily see it, but it extends from your shoulder all the way to your elbow. And talking about a few landmarks of our bone, it's important to know the first thing about the humerus is something that you have at the topmost point of the humerus. You have a head.
Yeah.
And
real quick, I mean, don't all bones of the body have a head? Maybe not. Like the phalanx and all that.
yeah, not necessarily a head.
Yeah, maybe the big ones.
Maybe the big ones. Yeah. We're gonna get in depth.
The big ones have a head.
Okay, let's not make that an official statement right now.
Okay.
We're still learning.
Yeah.
All right. So very close to the head, you got two tubercles in the humerus. Now, you might want to ask me, what are tubercles? So tubercles are just like, think of them like a little bony outgrowths, a little protuberance, and they act as special landmarks for muscle attachments, for maybe some muscles to pass through, and just like bony outgrowths. It'd be much easier for us to show it if we actually had the bone, but hopefully we'll be able to add some pictures for the viewers to see it.
Yeah.
All right, so the two tubercles are, one of them being the lesser tubercle, which is a little bit on the medial side of the humerus, and it kind of protrudes out a lot more than the greater tubercle. And Raj, what do we have between the two tubercles?
I'm pretty sure it's referred to as the bicipital groove or the intertubercle groove.
Yep. So
Yep.
it's either known as the intertubercular sulcus or the bicipital groove.
Sulcus.
Stick with whichever one you find easier, I guess. And separating your head from the tubercles, you have something that is known as the anatomical neck. And then separating the tubercles from the rest of the bone,
You have the surgical neck.
exactly.
Yep.
And the name of the surgical neck is the surgical neck because it is a site for most fractures. So it requires the most amount of surgeries, and yeah, it is a very common fracture point in adults. Anyways, real quick, going back to the bicipital groove, I know we said that it lies between the two tubercles.
Yeah.
And I also remember studying how the bicipital groove can act as an attachment for 3 different muscles.
The bicipital groove, yes.
So one of the muscles attaches to the left, or to the lateral side, one to the medial side, and one on the floor of the groove.
The basement.
Yep. So do you remember the names?
Yeah, and we actually have a mnemonic for this, and this one is the lady between two majors. Okay, for the lady, that is referred to as the latissimus dorsi. So the latissimus dorsi goes ahead and, I'm sorry, I forgot, is it the origin or the insertion?
It's not necessarily the origin or the insertion, it's just like a point of attachment on the groove.
Okay.
So I think we'd probably learn it as latissimus dorsi, or basically in common terms, the lats, or the big back muscle. Oh, and I love training lats. I love training lats.
Right.
We're going to see them in
Yeah.
the future videos.
But okay, so we got the lats, then we have
They attach on the floor of the bicipital groove.
yeah, lats are on the floor. So it's a lady between two majors. So the major on the side is going to be the pectoral major,
Pectoralis major.
pectoralis major, and then the one on the medial side is going to be lady. Is it teres major? Yep,
Yes.
teres major.
Okay, so that's our lady between the two majors and the three muscles that attach on
the
the
bicipital groove. Yep.
Oh, wait. So we also have that out of
And
the way.
the bicipital groove, it is going down towards the shaft a little bit, right?
Not necessarily. I think anything below the bicipital groove, we'll call that a shaft. Shaft is basically the length of the bone, and we're going to hear this word multiple times, even with the radius and the ulna. Basically, the length of the bone.
It's like the narrower part of the bone,
Yeah,
because like the
it's
head's a
the
little bit
shaft.
bulky and then goes down, and then a
And
little
then
bit.
you have more stuff on the distal end of the bone. You have some stuff on the proximal, but the one in the middle, the long bony part, is the shaft. And in the case of humerus, I guess we're lucky we don't have much happening on the shaft. We just have one tuberosity, or again a bony outgrowth on the lateral side of the humerus,
That
which is
is
known as
the deltoid tuberosity.
yes, and is an
Yep.
attachment for the
Deltoids.
deltoid muscle.
Yeah.
Perfect. All right, we want to move on to the distal part of the humerus now.
Okay. Distal part of the humerus. I don't like this part.
We'll go one step at a time.
Yeah.
Okay, so on the most distal end of the humerus bone, on the lateral and the medial side, you're going to see, first of all, two epicondyles. These are, once again, maybe little outgrowths.
Outgrowths, or are they like little dips?
Epicondyles?
Yeah.
Thought they're outgrowths.
Maybe they are outgrowths. No. The fossas are the little dips for the
Yeah.
for the other muscle.
Yeah,
the
I
other
think
bones to
not
go
necessarily
get into.
outgrowths, if anything, just bony structures, but they're known as the medial and the lateral epicondyle according to their location. And right above the epicondyles, you also have medial and lateral supracondylar ridges. So these are the ridges that are kind of running on the body of the bone, or on the shaft of the bone.
On the sides.
Yeah. Now, what's important with the distal part of the humerus is that it also helps make up our main elbow joint.
Yeah.
And the elbow joint is also, you could think of it as being made by three different bones, right? So the distal end of the humerus bone, and then we have two bones in our forearm. So the proximal ends of the radius and the ulna.
Yeah. We haven't talked about the radius and the ulna yet, so we can go ahead and talk briefly about them real quick. So on the lateral side, on the lower part of the arm, right underneath the elbow joint, you have two different bones. On the lateral side, you have the radius, and it's on the same side as your thumb. And then on the medial side, you have the ulna.
Yep. So two bones of the forearm.
Two bones. of the forearm.
Yeah, it's not too bad. I would say what's important is to see their attachments and how they're attached with the humerus. So
That's
now,
the part that gets bad.
well, not too bad.
And it's not horrid.
It's not horrid. Okay. So on the distal end of the humerus, you have on the lateral side, you have a bony structure known as the capitulum,
Capitulum.
and on the medial side, you have a bony structure that is known as trochlea. And what they do is help connect with the radius and the ulna, respectively. So the capitulum helps connect with the radius, and the trochlea helps connect with the ulna.
Yeah.
And now, for example, just kind of visualize it. I know it's hard to kind of visualize with anatomy, but this is how we're learning. So
Yeah. We have the trochlea here, and we have the capitulum right here. And right above the capitulum, there is the radial fossa.
Yep.
And this is where the radius goes ahead
And kind of fits
just
in, like a
fits
puzzle
in.
piece.
And then medially, you would expect it to be the ulna fossa, but there's medicine for you. This is not the ulna fossa,
It's the coronoid fossa.
coronoid fossa.
Yep. And it's the coronoid fossa is just due to the site of attachment of the ulna, because on the ulna, when we move ahead towards the ulnar bone, we're going to study how there's a coronoid process on the ulna that fits into this coronoid fossa, hence the name coronoid fossa and not ulna fossa. I think they're just trying to be a little bit more specific.
Right.
Okay, so there's that. So now we got everything out of the way, I think. Just to sum it up real quick, we got the head, we got the two tubercles, lesser and the greater tubercle. In the middle, we got, between the two tubercles, we got the bicipital groove or the intertubercular sulcus. Towards the lateral side of the humerus bone in your shaft, you have the deltoid tuberosity that helps attach your deltoid muscle. And on the distal end, you'll see a lateral epicondyle, medial epicondyle. Above the two, you'll see lateral and medial supracondylar ridges. You'll see two bony structures, capitulum on the lateral side that connects with the radius, trochlea on the medial side that connects with the ulna. The radius slides into the radial fossa, and the ulna slides into the coronoid fossa of the humerus.
Yep. Okay, real quick, before we move on, we went over the radial fossa and we went over the capitulum fossa. No, not the capitulum fossa.
Coronoid.
Coronoid fossa.
I just remembered by the name of the coronavirus. Coronoid, corona.
You always tell me, but I haven't been able to learn this yet. One day I will.
It's confusing. Yeah.
Coronoid fossa. Coronoid fossa. Right here, there's another fossa, and this one's called the olecranon fossa. And it kind of articulates like kind of joins with.
Attaches, yeah.
Yeah, attaches with the olecranon process of the ulna.
Yeah.
And you're going to learn more about that as we go on, and it'll start to click in, hopefully.
Yeah, everything will make sense once we also study about the radius and the ulna. But right now, just the thing to keep in mind would probably be the three main fossas of the humerus. One's on the lateral side, that's the radial fossa. The one on the medial is the coronoid fossa, and the one on the posterior end is the olecranon fossa. And these are all on the distal end of the humerus. And they all serve as attachments for the ulna and the radius. They're the two bones that we're going to move on now.
Okay. So, like we already talked about it, the radius on the lateral side, ulna, medial side. And we're always referring to the anatomical position.
Yep.
Yeah,
So,
I'm just emphasizing that a little bit because sometimes I'd be like, this is our lateral side, and then this is, I was like, okay, this is the radius. Nope, that's the ulna.
yeah, so the anatomical position is important. Your arm and your palm is always facing forward.
Yeah.
So in the anatomical position, your lateral side is the radius. So again, if you do get confused with the anatomical position, you could also remember it by just radius being the side towards your thumb. That's it. Okay, so with the radius, again, a few landmarks of the bone. You have a head, you have a neck, you have a radial tuberosity. So another tuberosity, again, a site for attachment of the muscle. Radial tuberosity is somewhere on the lateral side running along the shaft. And of course, you have the shaft, that is mostly the length of the bone. And on the distal end of the radius, you have something known as a process, which I'm going to get to later, but it's known as a styloid process. And this styloid process is present distally in both radius and the ulna. So as of now, I think one important thing to note is, and you might remember this as well, that the radial, what muscle attaches, or radial, actually let me reframe this. Radial tuberosity acts as an insertion point for which muscle?
The bicipital brachii?
The biceps brachii.
The
Yep.
biceps brachii.
So every time you go to the gym and flex your biceps brachii, you kind of can think about it, oh, that's the insertion right there. So, I mean, I think the first time we got to know about this, we were kind of surprised, because when you think about biceps, you just think about, okay, that's our bicep. But in fact, your bicep kind of runs all the way here till your radius, till your mid-radius, and that's where your muscle inserts. So if you want to do this right now, you can test it out. Try flexing your arm, and you're going to feel a muscle that is also flexing on your forearm. And that is your bicep brachii that is being inserted at the radial tuberosity.
Yeah,
Yeah, so that's kind of cool.
that was nice.
All right, do you want to get into the radial ulnar joints? The proximal and distal?
Radial ulnar joints. Okay, so the way that these radial and ulna, they do connect. So I know proximally.
So they're not just connected to the humerus, they're also connected to each other.
Yeah, so proximally, the radius is attaching to the ulna. That is because there is a radial notch on the ulna. And as you move down distally, there is a ulnar notch on the radius. So it's kind of connecting right here, and then boom, and then it's connected like here.
Yep. So on the proximal end, your radius joins to the ulna, but on your distal end, your ulna joins to the radius. But again, both of these joints, now joints are what? A bone-to-bone connection, right? So these two bones being connected, they're just known as radial ulnar joints. And it's in the name, the two bones joining are the radius and the ulna.
Yeah, pretty simple.
Yep. And, one fun fact, and here is a little bit of a clinical side to this. There's this ligament that stabilizes both of these radial ulnar joints. and it's known as the annular ligament. And what happens is that sometimes in kids less than 5 years of age, a lot of times the radius head, it kind of pops out of the annular ligament, and it can lead to something that is known as a nursemaid's elbow. And why the name? Because a lot of times when, I don't want to say nurses, I just don't want to put something other, but anyways, it could happen that a lot of times nurses or even doctors, if they're dealing with little babies, you could probably maybe pull the arm a little too hard, and it could lead to the head of the radius kind of popping out of that ligament, and which is basically also known as the radial head subluxation.
Subluxation.
Yeah, just like it kind of moved from its.
This pops out.
Yeah, it pops out.
Subluxation.
So the radius head kind of gets forced out of the annular ligament, and then you need to get that treated. But yeah, that is very common in kids less than 5 years of age.
The radius subluxation.
Radius head subluxation.
Radial head subluxation. Okay. Pop out.
Yeah, and that's pretty much all about the radius. The radius and the ulna, they're not too complicated of bones. They have a head, they have a neck, right? In the radius, you see a radial tuberosity, and you have stellar processes on both of these bones on the distal end. But one important, actually, two important things to mention about the ulna is the two processes that are present on the ulna. Now, again, what is a process? I said I'll get back to it. So a process is, again, another projection or protuberance or an outgrowth on a bony structure, and it could serve as an attachment site for, again, a muscle or ligament or even another bone. So in this case, the ulna has three different processes. One of them is the trochlear process, and I'll let you guess what it does. So the trochlear process on the ulna.
Trochlea.
And all these processes on the ulna, they're on the proximal side of the bone.
So what does this process do?
You tell me.
Probably help with attachment.
To
The humerus.
how? Towards, yes, it does help attach to the humerus, but through a bony structure known as, it's in the name.
The trochlea.
Yes.
Okay.
So the trochlear process helps attach with the trochlea. All right, and then there.
And this is on the ulna.
Yes.
Okay. The trochlear process of the ulna attaches to the trochlea that is on the humerus.
Yeah, I would say on the distal end of the humerus. It's
Distal
a
end of the
bony
humerus.
structure. Another bony structure. And then you have the coronoid process.
Coronoid process, and that
Attaches to the coronoid fossa. So it kind of fits in the coronoid fossa that we talked about. So now the coronoid fossa name hopefully makes sense.
they could have just called it the ulna fossa and the ulna process,
But they did not.
but they didn't.
So now you got to remember it
Yeah.
for what it is.
Yep.
And the last one is the olecranon process. So the olecranon process,
It's on the backside.
Yeah, on the posterior ulna, which kind of fits into the olecranon fossa of the humerus. That is also on the posterior side. So think of it like, I would say fossas, they're like maybe some depression, like a little pit, and processes are these bony outgrowths that kind of fit into that pit. It's like a puzzle piece.
Yeah. All right. So these were, I think we covered about everything for the ulna, the radius,
Yeah,
and the
so
humerus.
these are basically all the bones of your upper arm and forearm.
Okay.
It's just
And-
3 bones.
Yeah, it's just 3 bones, but they have so many different articulations, fossas,
I know.
processes. And now we can go ahead and move on.
To the hands and the wrist.
Yeah, you see your wrist flicking? It just doesn't happen naturally. These are called carpals.
Yep.
And
8. Are you literally,
Huh,
are
okay.
you saying the mnemonic in your head?
yeah, I'm saying
Okay.
the mnemonic in my head. So there's this mnemonic. She looks too pretty. Try to catch her. So 4, 4. The first row is full of 4. The second row is the other 4. She, scaphoid. L, looks lunate. 2, triquetral. And all right on top of the triquetral, you have pretty, known as pisiform. She looks too pretty. Scaphoid, lunate, triquetral, pisiform. First row is done. And then you have try to catch her. Try,
Trapezium.
trapezium. And then you have the trapezoid. She looks too pretty. Try to, trapezium. Catch for capitate. And then her for hamate. She looks too pretty. Try to catch her.
Yeah, so that just means that you have like a proximal row of carpals and a distal row of carpals. Proximal is just the one that we're saying it's closer to the body, and the distal is like a little further away from the body. And The first row, sorry.
I was going to say, your radius goes ahead and articulates with the first two, so scaphoid and lunate. So this is kind of making the wrist joint.
Yeah, so the wrist joint is basically just mainly made by two carpals. That's your first two, the scaphoid and the lunate, and they articulate with the distal end of the radius. So yeah, you have 4 in the first row, 4 in the second row: scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate.
Yep.
Okay, so these are your 8 carpals. They're present on your wrist. And then
you have your 5 metacarpals.
Yes.
So metacarpals and phalanx.
Metacarpals like on the palms.
Yeah, but they're just 5 of each. That was what I was trying to say.
Yeah.
So 1, 2, 3, 4, 5, and then you have the phalanx.
And then 5 phalanges. Yes.
Phalanges, but singular they're called phalanx.
I think so. Singular is phalanx. Yeah.
Singular is phalanx.
Pretty
Multiple phalanges.
Phalanges.
Okay. Carpals, metacarpal, phalanges, and then.
So you got 8 carpals, 5 metacarpals, and let me ask, how many phalanges do you think we have?
7.
Why do you say 7?
You see that?
No. Okay. No, seriously. How many?
5.
No.
We have 4.
That's the fun part.
4.
No.
8.
No.
Hold on. 1, 2, 3, 4, 5, 6, 7, 8, 9,
Not
10,
even.
11, 12, 13, 14.
We got 14 phalanges.
14.
Yes, and these are like you would say, okay, I only see 5 fingers, so 5 different bones, but
Right.
all these little bones, all these long bones are divided into three for the fingers and divided into 2 for the thumb.
Yeah.
So
I didn't know that. I knew that.
you didn't know the divisions, but you just
I didn't-
didn't know that you count them separately.
Yeah, I didn't know we counted them separately. I was like 1, 2, 3, 4, 5, but apparently not. That's
Yeah,
crazy.
Yeah. So all the phalanges of the fingers, they're divided into 3: the proximal phalanx, the middle phalanx, and the distal phalanx. Proximal, middle, distal, proximal, middle, distal, proximal, middle, distal. And this one, the one for the thumb, it's only divided into 2: the proximal and the distal. So it does not have a middle phalanx. Okay. So now that we're saying that there are 14 phalanges, right? And all of these different bones, they're attached with each other. So a bone-to-bone attachment is a
Joint.
joint. So all these joints, they have their names. So the joints that are attaching your proximal to the middle phalanx, they are known as
Pips.
pips, that also stand for proximal
Well,
interphalangeal joint.
And then the one that is distal,
So this one right here,
dips.
they're the dips.
Disp?
They're the dips, or the distal interphalangeal joints. They attach the middle phalanx to the distal phalanx.
All right, let's not forget about these ones right here.
Oh no, how can you ever forget about those? Those are important. So your knuckles right here. Now, all right, so I said these are the pips,
These are the dips.
these are the dips, and then what about these? These are your metacarpals.
Phalange joint.
Yes.
MCPs.
So you could call them MCPs. Why?
MCPs.
Because they're connecting your metacarpals to your phalanges.
MCPs.
So you're calling them metacarpal phalangeal joints, or the MCP. All right. Fun fact.
What?
If you're facing a problem with your MCP and your PIP, so MCPs or your PIPs, it is an indication of rheumatoid arthritis.
What arthritis?
Rheumatoid.
Rheumatoid.
Yep.
Okay.
And if a patient is having troubles with their dips or the distal interphalangeal joints, then it's an indication of osteoarthritis.
Osteo.
And now these are both arthritis, but different types. So
Osteo
this
is the
is
bone, right? Osteo, yeah.
yeah, bone cells. I think osteoplasts, but the thing is that they're both arthritis, but it's a good indication to tell why they're different and how can you tell which arthritis a patient has. It's a good way to tell.
Just a fun fact.
Fun fact.
Fun.
All right.
I think this is all we had for.
I think so too. One important thing is that considering the thumb only has a proximal and a distal phalanx, the joint over here is known as the intermediate phalangeal joint.
Yeah.
It's not a pip or a dip. It's just
Interphalangeal joint.
intermediate phalangeal joint. Yeah.
IP.
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 Just IP.
IP.
Oh, one more important joint. So the joint that connects your carpals to your metacarpals is the carpo-metacarpal joint.
Carpal, metacarpal joint.
So basically, these joints are not too complicated because they're kind of the name tells their attachments or the 2 bones they connect. So here you have the carpo-metacarpal joints connecting the carpals and the metacarpals. Then you have the joints connecting the metacarpals to the phalanges, the metacarpophalangeal joints. Then you have the proximal interphalangeal joints, the distal interphalangeal joints, and the intermediate phalangeal joints.
Okay, so these were just the bones of the upper limbs. So these were all of them. I don't think we missed out on any.
Yeah, real quick, humerus, radius,
Radius,
ulna,
ulna,
carpals,
metacarpals,
metacarpals, phalanges.
Okay, so these were the bones. We haven't gone to the muscles yet. There's a lot of them. I know you think like biceps and then the forearm muscles. No, man.
We'll get to them.
Yeah.
We'll make separate videos, and hopefully this was fun to watch.
Yeah.
Before we end this video, we're gonna leave you guys with a question, and feel free to comment in the comment section below on which bone do you think people break the most in their arms, and we're talking about adults over here. So which bone do you think is the most vulnerable to fractures in adults? Yeah, we're excited to see what you got for us. We are Learn, Live, Repeat, and stay tuned for future videos.